okay, considering I've written to Boris and to my local MP and to the Health Secretary and Matt Hancock and others, and of course they're going to ignore it, then I'm going to write to Jonathan Ashworth instead. Oh, not them. Ugh. Ugh. Not them. Jonathan Ashworth. Here he is. There he is. Now, I'm writing to him, right? It's an open letter though. But my letter to, well, one of my letters to Boris and his gang said, well, I quoted the WHO and I quoted, a couple of these people. Okay, head of the WHO's Emerging Diseases Unit said it was impossible to say when the pandemic would peak globally. Tedros, never mind, he was right here, stressed the countries should take a comprehensive approach, not testing alone, he said, not contact tracing alone, not quarantine alone, not social distancing alone, do it all. Find, isolate, test and treat every case to break the chains of transmission. That's not an easy ask, actually. Do not just let this fire burn. Any country that looks at the experience of other countries with large epidemics and thinks that won't happen to us is making a deadly mistake. Now, Dr. John Campbell suggested that was a direct arrow shot at the British government. I think he's right. Michael Ryan, who heads the WHO's emergency programme, stressed that so-called social distancing measures, including banning public gatherings and school closures, are not a panacea. They are not going to stop this on their own, he said. Quote from The Guardian. So, dear sirs, I get a feeling that the UK is giving up too soon on fighting this disease by contact tracing, but I might be wrong. I guess from the below analysis that it might be an impossible disease to stop. But Singapore's valiant attempts to stop this have been at least partially successful, and so have ours. We must take the required action sooner than later. Later means many more deaths. Sooner just means people will get annoyed. I would prefer the latter of those two. Yours sincerely. Okay? And then I sent him some graphs, which they will never look at anyway, but sod them. Right, so instead I thought, let's go for the opposition instead. Jonathan Ashworth. So I'm going to read out my letter because it's easier to write things than to make them up as you go along. So see if you agree. John.ashworth.mp@parliament.uk. Dear Jonathan, I have written to my own Member of Parliament Philip Hollowbone a number of times and also copied his message to the Prime Minister's, Health Secretaries and Home Secretaries' offices. I do not expect that they are being read, of course. No, they're going in the bloody trash in the spam folder. I did get one reply from my MP, but after that, nothing. Okay, and then I say I'm an educated scientist, blah, 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 blah. That's irrelevant. I look with some dismay at the science that the government is putting forward. In my profession, I've been used to problem solving and data analysis. Also in forensic type investigations of problems that occur in technical industrial production settings. I saw your tweet just now, which is that one that I had there. This is why we repeat our call for the government to urgently publish modelling and evidence base. Many are understandably asking why we're not testing more and moving to further social distancing measures. It's vital that they are fully transparent. Well, yes, it is. Although, if they're fully transparent with a crap policy, I'm not sure that really helps. Actually. Okay. Let's get on with it. I saw your tweet now repeating your call for the government to publish its evidence base for their decisions on testing and mitigation. I am highly concerned that the government is going down the road of taking extraordinary powers whilst not doing the things necessary to limit the epidemic. I wonder if you agree. I think that it's time that this becomes a political issue, even though I'm not a Labour voter. I didn't vote for anyone in 2019. No wonder. I have my own blog on COVID-19 data analysis and also a YouTube channel, not monetised ever. The emphasis is on objective data analysis and forecasting using simple tools. After looking at data from the WHO situation reports that started at number 1 on 21st of January 2020, I looked for patterns in the data and found that it is actually not complicated to forecast outcomes once strong quarantine measures are put in place, and it isn't. These are completely essential to happen as soon as possible, the quarantine measures. Going straight to mitigation without maximising the benefit of quarantine measures is insane in my view, and maximising the benefit of contact tracing also, I forgot to mention. It is clear from even a basic statistical analysis that even once quarantine measures are put into place, e.g. in Wuhan, Hubei province, China, South Korea and Italy, there is still very likely to be a tenfold increase in cases or more from that point on, although it does slow, because you're at the bottom of the curve. You quarantine and it still keeps going up, and then it goes over the top. Okay? For example, Italy has been in the several thousands, and now they have locked down as they are on their way from 10,000 to 20,000. My forecast for Italy stands at about 150,000 cases at present. Contrast with South Korea, where my forecast was for 10,000 to 14,000, but has converged now towards 9,000 cases for this current epidemic. I think they started their quarantine very early on, maybe at sub 1,000. Okay. I should have mentioned that there. So that's another factor of 10. For China, I also had figures of 70 to 110,000 declared cases, and even the interruption of the trend by the addition of maybe 15,000 plus clinically diagnosed cases around 14th of February, typo, did not stop the deceleration that was already in place. For several weeks since then, my forecast has been in the low 80,000s, and that is where it is landing. You can see my charts on the blog or YouTube. Yeah. Plug. They are plain to see, and they're on the record for as long as I have these accounts. Now, I probably should have mentioned there that Wuhan locked down. There were fewer than 1,000 cases in the world. Well, officially. Okay. So they had maybe a 60-fold increase after they quarantined. But they stopped it, right? They were successful. They stopped it for now. They quarantined here, then it went bonkers, but because of their quarantine here, it levelled off. Total cumulative cases. This is the rest of the world, it's a disaster. China, Hubei, rest of China. Okay, these two add up to the total China, obviously, and they're all converging on a level, not increasing anymore. But there is a little bit of a caveat to that, actually. Okay. This is the nub, really. I do have a fear that even despite the quarantines that China and later South Korea may experience clusters, this is definitely happening in China outside of Hubei right now, that could see a new epidemic when they release quarantines. But of course they can look at the evidence and release quarantines gradually if this is a danger. Perhaps the disease is actually going to infect most of the world's population because it's so infectious, but it is insanely defeatist to do what the government leaders have been discussing here and playing for the worst case scenario, which is what they are apparently doing, isn't it? That is, well, murder, really. China and South Korea have delayed their epidemics greatly at massive cost, but their countries are still surviving. Let's leave that there. Therefore, they have allowed their people time to be rescued in any potential second epidemic by a vaccine or a clinically trialled drug treatment, or simply by a warming of the weather in summer, which may have an effect. Since the science is conjectural and many papers are being published online even prior to peer review to get the data out, the science is not set in stone, not by far. As a British citizen of 54 with a pre-existing congenital cardiac problem, I'm deeply worried about the consequences of 1. Non-availability of a swamped NHS to patients with conditions other than COVID-19, 2. Getting infected with COVID-19 during an essentially unlimited epidemic in the UK, and 3. Running out of essential cardiac medications in a chaotic supply chain situation. Any of these 3 situations could result in my death this year. So could walking under a bus, but it wouldn't be the fault of the government. The government, and in particular the Prime Minister and his 2 main advisors, have adopted a defeatist attitude which in my view could lead to the deaths of many hundreds of thousands if there is any flaw at all in their science, and even if there isn't. Dr. John Campbell, hooray, in one of his many excellent YouTube videos, has highlighted the contradictions between the government's stated policy and the strong WHO advice given over the past few days to adopt a comprehensive approach. He mentioned many contradictions in that video, but here is an additional self-contradiction that I've just seen, which I swore about in my previous video. The government might arrest breakers of quarantine. However, they are not intending to test most possible COVID-19 patients who are self-isolating at home. So how will they know who is breaking quarantine? They are planning to test only when hospital assessment is done! Exclamation. That means that they will not be able to know whether someone is a COVID-19 case, or if they have, or not, if they've not already visited hospital. Are they going to arrest suspected cases who haven't even been tested and might just have the flu? It is patently absurd and self-contradictory. On that note, I would like to leave these above thoughts with you. Yours sincerely, David Bellamy, covid19stats.blogspot.com. And now I'm going to go and do my forecast, which I shall broadcast. Well, I'm knackered now. It's Sunday night. I might do them later tonight or tomorrow morning. So until then, good night and see you, and thanks for watching. Thanks very much for watching. Please subscribe, spread the videos around, spread the message. I think the government is completely failing us at this time, and that is a deadly mistake.